Dear viewers, welcome you all to our show, Orthopaedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today is our Independence Day and we are celebrating the 50 years of our Independence Day, as well as we are celebrating the 100th birthday celebration of our Father of Nation, Bangabandhu Sheikh Mujibur Rahman. I would like to dedicate our program to Bangabandhu Sheikh Mujibur Rahman and all the freedom fighters who fight for our country. Dear viewers, today our topic is osteomyelitis in children, a very important and very dangerous disease for children that can be treated by Ilizarov fantastically. So the topic is osteomyelitis in children treated by Ilizarov. And the speaker is one of the most fantastic speaker in our country.
Ammo.
Sir, please continue.
Барри, следующая пятница тоже будет вебинар?
Да.
А тема какая? Да.
Oh, sorry, it was a network problem, I think so.
Tema we bujirishi. Okay.
Dear viewers, we are coming back again. Yes, and our topic is the osteomyelitis in children and treated by Ilizarov. I think it is a very important topic for all of us. And our speaker is Professor Mufakkarul Bari sir, the fantastic speaker. And I would like to request Professor Mufakkarul Bari sir to join with us. Thank you, sir. Welcome to our show.
Thank you. It is a proud privilege for me that today I'm going to talk on Ilizarov on our 50th anniversary of the Independence Day. And at the same time, we're going to observe the 101 years of our father of the nation, Bangabandhu Sheikh Mujibur Rahman. And today, I'm going to talk on the osteomyelitis in children, this is a very burning question and burning things for the orthopedic surgeons, not only for the Ilizarov surgeons. And
before that, sir, I would like to request our honorable academic expert, Professor Novikov, sir, from Kurgan Institute of Russian Institute of Ilizarov, to join with us.
Good afternoon.
Good afternoon, sir. Sir, I would like to thank the Russia, as because of Russia helps us a lot during our during 1971. We would like to give a salute to all Russian people in our Independence Day today.
Thank you. I will send your thank you for all of Russians.
Thank you very much, sir. Now, I would like to request Professor Mufakkarul Bari sir to start his fantastic presentation regarding osteomyelitis in children treated by the magical Ilizarov.
Tanveer, for introducing me. And today I'd like to talk on severe chronic osteomyelitis in children with gap and shortening of the limb. And I always believe in case of children that osteomyelitis burns in the fire for regeneration. So these are the institutes where I worked. This is the 100 years of the institute. Last year, they observed in Kiev, capital of Ukraine, Institute of Traumatology and Orthopaedics. And you can see in the right side, this is my Tashkent, where I did my PhD. And in Kiev, I did my MS. And this is the new building of the Tashkent Scientific Research Institute. And this is my center where I worked several times. This is the biggest center in the world, which is called the Orthopaedic Capital. And this is, of course, the biggest in Southeast Asia, 1,000-bedded orthopedic hospital, which is situated in our capital city. Now I am working in these two big hospitals with the diabetic patients and Ilizarov technique. And this is my center. I always love to show this 4M, man, made, method, and a magician. Now let us see the recent advances in the management of chronic osteomyelitis, which includes radical resection, bone transport, improving nutritional status, anatomical and physiological emphasis on classification. If you think about that, the Czerny made a classification, and of course, we shall have to know the new antibiotics. If you think about the anatomic classification or adult chronic osteomyelitis, the 4 types: intramedullary, superficial, local, and diffuse. Chronic osteomyelitis is often associated with angular or rotational deformity. The angle may be in any plane such as procurvatum. You can get precurvatum, varus, valgus, and in the oblique plane also. And the deformities of the adjacent joints. And of course, you'll find the LLD, and sometimes you're going to have a deep cavity in the bone, a big sequestrum, which creates a big gap. And in my country, chronic osteomyelitis is very common. Severity are measured by 2 parameters: Czerny Meder classification and local status, such as the length of the gap created after debridement, shortening due to growth arrest and the gap closure, growth arrest, formation of involucrum, and presence of osteomyelitis. If you look at this X-ray, see the pathological fracture with formation of the involucrum. Look at this chronic osteomyelitis of the whole tibia, pendiaphyseal osteomyelitis of the whole tibia. And I have done these several cases in different corners of my country, and duration from 1990 to 2020, in total 270 cases. Out of these, 115 were severe. Age ranges 1.5 to 25 years. The cases were treated as thorough debridement, removal of the sequestry, correcting cavity, acute docking. If acute docking is not possible, then gradual docking is done. Chondrodiastasis or corticotomy and application of Ilizarov frame. Gaps were closed by bone transport. Lengthening was done as required. Deformity is also corrected simultaneously. Pendiaphyseal osteomyelitis with pathological fractures were treated by only the stable fixation of Ilizarov with full weight bearing and motion. Why we are using Ilizarov? You know, the Ilizarov is a compression distraction device which gives flexibility and adaptability. 1 or more levels for correction of multidirectional, multiplanar, multi-level axial deformities superior to other conventional methods. Now, the advantage, if you think about the Ilizarov, minimally invasive, decreased neurovascular and soft tissue injury, no chances of infection, rather you can control the infection, and severe multidirectional deformity you can correct. Now let us see the chronic osteomyelitis of the left tibia. You can see here, left side radiographic view of the patient. Now what we have done put a guide wire and 3-ring construct after 1 month follow-up. You can see after 8 months follow-up, and this is, you can see, if you compare left one with the right one, you can see full bone consolidation after 1 year follow-up. This is, if you see at the left side, and if you compare it after 1 and 3 months, patient can squat and bone consolidation is very good. And you can see this one, 15 years old boy, osteomyelitis non-union shaft of right femur. See the angulation and see the sequestrum there. What I have done, I have not done anything. I have put the Ilizarov apparatus with multiple wires and olive wires. And this is radiographic view on the left side. You can see after 2 months follow-up, and patient with the Ilizarov fixator with the smiling face. Now you can see, dear friend, this is the only follow-up after 4 months. Biocompatible thin wires. And this is the boy. You can see the discharging sinus. You can see the discharging sinus in the back side. And this is the pathological fracture. Pathological fracture. You don't need to do anything. What to do? Just you put the Ilizarov apparatus with biocompatible thin wires. See here, half ring, full ring, and I fix this with only the wires. And after 3 months follow-up, you can see a union is achieving here. And at the same time, during treatment, patient is continue to walk. You can see here that patient can walk with the help of Ilizarov apparatus. And the boys and the girls, they can easily adjust with the Ilizarov apparatus. So fantastic view of the how after application the patient can move with this apparatus. Now this is the before. Now you can see after 5 months follow-up. The same patient after 11 years of follow-up, you can see if you compare the left side of the X-ray and middle of the X-ray, and after 11 years follow-up, you can see here. And the patient came to me after 11 years for second step surgery. And I have done the, in total 17 centimeter, it was LLD, and I did the lengthening of the femur and the tibia. Now patient is going ongoing treatment. So this is the monofocal bone transport, how we can transport the bone. You can see here, and this is the bifocal, when you can go for both sides, from the top and from the back, from the lower part. So 9 years old girl with pendiaphyseal tibial osteomyelitis. Here you can remove the all dead bones, and as a result, what you are getting a gap. And at the same time, you can go for corticotomy and gradual bone transport. In general, 0.25, 4 times a day we're doing. Now you can see the massive callus formation. This is a destruction angiogenesis. The same girl, you can see recorticotomy done after 3 years for lengthening. You can see the right side massive bone callus with a very big, heavy upper part of the tibia. And now you can see here pendiaphyseal osteomyelitis of the left femur with pathological fracture. You don't need to do anything. What you'll do, just you fix the fragments, half arch and 2 rings with biocompatible thin wires, and you allow your patient to go for weight bearing. And within a short time, after 15 days of Ilizarov fixation, and after 1 month, you can see how bone is forming. And before treatment, after 5 months, and after the removal of the or dismounting of the Ilizarov apparatus. Now you can see after 6 years follow-up, the same boy. This is the beauty of Ilizarov. The problems, you are not getting anything with the Ilizarov fixation, rather you are increasing circulation. Now this is the girl of 9.5 years old. She came to me with this formation of pathological fracture, and whole tibia is involved. You can see the left side, see the skin condition and the leg condition and discoloration of the skin. First step surgery, I have done nothing. Put the Ilizarov. Second step surgery and radiographic view before treatment, and you can see view after the treatment. Massive bone callus formation, and you can see this is the after 6 years follow-up. Look at the left side before doing surgery and the middle one, and this is after pandemic period. She came to me to show to have a consultation from me. And in different parts of the body. You can see left humerus with pathological fracture. If you look at this here, you can find, you can see here, this is the problem. Now you can, what I have done? Nothing. No debridement, no curettage, just put the Ilizarov apparatus with biocompatible thin wires. And what we have seen, after 4 months follow-up, you can see a good consolidation of bone is forming here, and the quality of the bone is improved, and the patient can raise her hand. And another case, you can see he was treated elsewhere by rash nail with infection with gross LLD in situ. Now you can see what I have done, keeping the rash nail in situ. I have put the Ilizarov apparatus with 1.5 or 1.8 biocompatible thin wires. And as a result, what we have seen, the good consolidation and good result. This is the second step of surgery. And you can see the before and only after 5 months follow-up, dear friends. Now you can see a full pendiaphyseal osteomyelitis right tibia with resorption of the upper tibia, 1.5 years old boy. Very a tiny boy, but you can do something. If Ilizarov in your hand, you can help the patient without any hesitation. What I have done, you just see, I have done a corticotomy, put a guide wire to make the alignment, and then what I have seen, radiographic view, you can see before surgery, and you can see after 1 year follow-up, and this is after 1 year follow-up, you can see here. So chronic osteomyelitis of the left femur, you can see shaft with pathological fracture. Again, dear friends, for the children, you don't need to open up. Don't need to open up. You just put the fragments, hold the fragments with counter-opposed olive wires or wires, and at the same time, allow your patient to go for exercises. And if you compare left side with the right side, after 1 year follow-up, you can see that what. So this is a 14 years old girl who came to me with the deformed forearm due to the osteomyelitis of the radial club head. You just compare bowing of the whole ulna and at the same time resorption of the radius. What to do? I have corrected the deformity of the ulna, and at the same time, in the distal part of the hand, I have denuded that part. And what I have done, see the curvature of the right radial hand before, and with the apparatus, patient could raise her hand to the mouth, and now compare the before and after. This is the beauty of Ilizarov. So this is the case. You can see the pendiaphyseal osteomyelitis of the whole ulna and proximal part radius with visible sinus. You can see here, dear friends, whole ulna and whole radius, this one. And distally, you can see this is a discharging sinus. And what I have done, patient came to me, and this is long back, and I have put the apparatus here, see, and allowed the patient to go for exercises or multiple exercises from different corners. And what as a result, you can see the no discharging sinus here. The whole bone is consolidated. Quality of the bone is good. You can see the whitening of the bone. That means only a little bit dislocation of the distal radius. No, it doesn't hamper his activities. Now, this same boy, after 8 years of follow-up, you can see, dear friend, this is the before surgery, after treatment. Now, after 8 years follow-up, the same boy. Only a little bit restriction of the elbow. See, he was treated elsewhere, 15 years old boy, osteomyelitis with non-union. And what I have done, put the apparatus, and you can see this is published in American Medcraft Journal in 2015. which was published 6 years back. And Ilizarov always serves four purposes. Whenever you are creating a mechanical condition which is necessary for development of distraction and compression, and you are getting, when you are giving this distraction or compression, you are getting billions of cells that are developed during the lengthening or during the compression and distraction. This Ilizarov apparatus, it increases the blood circulation 330% for increased metabolic transformation of local tissues. Most importantly, the medullary and the periosteal blood supply is not disturbed. And in my conclusion, dear friends, I'd like to say the radical removal of all dead tissues, lengthening of the bone and bone transport given excellent results. Children tolerate multiple lengthening very well. And that's why Professor Ilizarov was always fond of saying, osteomyelitis in children, that is, gives a very good regenerated bone. Bone resection and bone transport have revolutionized the treatment of chronic osteomyelitis. Recurrence is not due to the resistant organism, but to inadequate debridement. So, before going to apply the apparatus in Kurgan Ilizarov Center, they have an animal clinic, and they are doing all the time the research works, how to proceed with the animals, and after that, after doing research work, they're applying this in human body. So this is the transverse line of fracture of intact intraosseous vascular network after transverse corticotomy. You can see in the left side, and formation of the distraction regenerate following corticotomy after 28 days of distraction. And you can see in the X-ray image histological slide which gives Gerson's staining using picrofusion. 30 days after the assembly of the external fixator, you can see the regenerate bone, good quality bone, and new vascularization. The man I always love to say, the who made it possible. This is the great scientist, talented doctor, gifted innovator, creator of the apparatus, myriads of apparatus, and the methods of transosseous osteosynthesis, professor, academician, Russian Academy of Medical Sciences, Gabriel Abramovich Ilizarov. And dear friends, challenges in life comes in three categories. I always love to tell this one. Very easy, difficult, and impossible. And if you have an easy way, you have a safe and boring life. Those with the difficult way have a tough but satisfying life. But whenever you are thinking or you are doing something with the impossible things, you will be remembered forever. So whenever you think about the osteomyelitis, don't fear. Fear has got the two meanings: forget everything and run, or face everything and rise. And I love to face everything and rise. The choice is yours. And this is in pandemic situation in my center, Bari Ilizarov Orthopaedic Center. And we are treating varieties of orthopedic cases, not only the osteomyelitis, non-union, gap non-union, all varieties of congenital and acquired deformities. So I love to carry a home message to my all colleagues, junior colleagues, those who are willing to do something with the Ilizarov. If you want to do with Ilizarov, you should follow the principle and at the same time philosophy of Ilizarov. Ilizarov always shows the evidence, science, and of course the surgeon who is doing the surgery, surgical skill of the surgeon. I always tell to my friends, technology is very good for machines like computers and telephones. But in a human body, we need to go a step further. That is called biology. We must respect the biology. It is not always essential that a costly technique is more advantageous. Let us be the leaders in advocating biological and cost-effective techniques the globe might appreciate. And in my country, we are holding a strong foothold in Bangladesh regarding the Ilizarov technique and the technology. And dear friends, since 2006, I have written 7 books. and lot of international publications regarding the Ilizarov technique. So I love to share some photos with my Kurgan fellows, world-renowned Ilizarov surgeons in my house and in my dacha. So I convey my gratitude. Today is our 50th anniversary. Gratitude to all Russian doctors who helped us in 1971 during a liberation war. And the way that I learned, the discipline, the way of thinking, rigorous approach, truthfulness, sincerity, devotion, dedication, all this form the basis of my academic career. And I'm grateful to Gabriel Abramovich Ilizarov, and at the same time to my mentor, Professor Vladimir Ivanovich Shevtsov, and my dear friend, Dr. Novikov Konstantin Igorovich, and other fellows from Ilizarov Center. Thank you so much for your kind attention.
And I think
Yes. Everything was okay?
Hi.
Okay, thank you. Shamsulullah, okay, how are you?
I'm fine, sir. It's really
Fine,
good to see you
okay,
both,
thank you.
sir.
Thank you there. You have joined us, okay?
Yeah, it's a real pleasure, sir, joining, sir. Bari, sir, and Navikov, sir. It's a real pleasure for me. And today, our PM is there in Bangladesh. It's another great pleasure for the Indians and the Bangladeshi people, sir. Thanks again, and thanks to, sir, thanks to Tamil Rashwa Bhai also. So, sir, I heard your wonderful lecture, sir. Wonderful lecture, especially you follow the real principles of Ilizarov and biology in children. Following your cases and principles, I've done several cases of pediatric osteomyelitis with Ilizarov, like femur, like tibia, osteomyelitis. They have been doing very well, healing very well. I've done cases of debridement. The same principle you follow, sir. It's a real pleasure being here. Thank you, sir.
Thank you.
Noiko, sir, it's real pleasure seeing you after a long time, sir.
Thank you.
Tanvir is lost.
I think this year will finish our life.
Want to see you again in India, sir?
Yeah, we will meet in Bangladesh, in India, in Russia.
No,
Tanvir Ashraf is already disconnected, probably.
Yeah, disconnected. Let me continue, sir. Besides adult cases, I've done several cases following the principles like pathological fractures, pus, deformities, and even osteomyelitis. In osteomyelitis, I've just applied a laser frame, and the patients heal very well. Just seeing your cases, sir. It's very well, sir.
Exactly.
Sir. Yes, sir.
Exactly.
And Professor Bari, I want to say thank you very much for your unique, excellent experience, and you give us excellent example and excellent way how we can go away from any difficulties during our treatment. For example, today, nurse invite me in dressing room, and some wires was with infection. Without any problem, remove this wire, and I think during few days, all of problem will disappear.
Exactly.
Ilizarov message, this is possibilities. Possibilities go away from any difficulties and any problem with non-union, with infection, with contracture. Magic methods.
Magic methods. Yes. Main thing is that most of the orthopedic surgeons, the law of tension and stress, Ilizarov, law of tension and stress, which is introduced by Gabriel Abramovich Ilizarov, and the properties of the bones. What are the properties of the bones? Isoelastic, hydrostatic, and pneumatic. And this K-wire or Ilizarov wire flexibility, which is coincide the properties of the bones. As soon as you apply the apparatus with biocompatible thin wires, you allow your patient to walk and walk, and as a result, you will get a very good regenerate bone. These are the properties of the bone and the properties of the Ilizarov wire or K wire, which coincides and gives a fantastic result. This is the beauty of Ilizarov. And most of the orthopedic surgeons, they are thinking that putting the only wires. No, you must maintain everything. After application of the Ilizarov apparatus, you must cautiously, meticulously, always follow. As a result, you get a fantastic result. Fantastic result. In children, they carry apparatus without any hesitation. They jump, they're doing exercises, everything. And I'm getting always fantastic result. For the last, since my residency, working with Ilizarov. Now, whenever Ilizarov in my hand, I feel 100% confidence that I can overcome all the problems. Correct?
Correct, sir.
Absolutely.
Really agree, sir.
And Dr. Bari, this is magic music, and you see, any our problem, any our complication, we cannot comparison. For example, infection of wire, infection on plate. On the end, absolutely different result, because
Yes.
all our difficulties we can remove without any influence on the final result. And one more, with our methods, we need collaborate very close. All period of treatment, we need to be near with patient. I love this situation because just now patient, this is like my parents. Because usually when the doctor put a nail or plate, discharge, and then never contact. And one more, when we apply, when we put Ilizarov, we have some point, time of osteosynthesis. 3, 5, 6 months, doesn't matter. When we put nail, when we put plate, same situation. Time of osteosynthesis. For how many years? Foot nail doctor. Minimum 1 year. Usually 2 years. Plate sometimes many years. Please calculate this time. This is time of osteosynthesis. Not like Ilizarov, 5 or 3 months. Or this is very difficult or very long period of osteosynthesis. Colleagues, be clear. Calculate all period with metal from put till remove, including any metal. What do you think?
Yeah.
Professor Mavakarul Bari, sir, do you have any opinion regarding the speech of Professor Novikov, sir?
Yes, I am agree with him all the time because we work together. I know what is Ilizarov Center and what they are doing. Fantastic surgeon, Novikov, well known in the world, very well known.
We need more close collaborate because we have excellent team, and this is team ready for continued our collaboration with education, with treatment, with maybe published some experience and some results. And just now with Dr. Bari, we start this our project.
Thank you.
As Bari
We
sir
must-
correctly said,
We must disseminate We must disseminate the principle and philosophy of Ilizarov.
Yeah.
Oh, dear friends,
I am
85
agree.
to 90% orthopedic problem, trauma, deformity, you can correct only with this. You know, now I'm telling you, I'm working in a diabetic hospital. Distraction angiogenesis, distraction histogenesis. You can overcome all these problems with diabetic ulcer, with diabetic gangrene. Only the theory of distraction angiogenesis, distraction histogenesis, distraction dermatogenesis. Oh, fantastic. Only you should have to meticulously follow the principles. And my suggestions for the young orthopedic surgeons, everybody should learn Ilizarov. Everybody should learn Ilizarov to overcome all trauma problems and the deformity correction. Whatever may be the external, there are a lot of external fixtures in this world. SUB, Taylor special, but for the third world country, Ilizarov is the best still. Ilizarov is the best. And this is cost effective, minimally invasive. Only problem is that our young doctors, they don't want to gather knowledge, the basic of the Ilizarov, and then you go for the advance. If you acquire the basic knowledge of the Ilizarov, then you will be a fantastic orthopedic surgeon, not only Ilizarov surgeon. You can overcome anything only with K-words and technology, nothing else. Ilizarov words and technology, starting from the neck femur, then shaft, then any intraarticular fracture, any deformity, and of course the the osteomyelitis that I have shown. I have shown a little bit, but I have lots of thousands cases we have done, because population is too much high. In Russia, see, they have in Kurgan Center 370 orthopedic surgeons, Ilizarov surgeons. In Kurgan Center, 370. Their population is 14.5 crore, and my population is 17 crore. Think about India, 135, 140 crore people. So we have a lot of cases, and we can help only with this Ilizarov technique. Why I'm advocating all the time? Because I'm getting fantastic result, and I follow the principle. I follow the original Russell principle, not the hybrid principle. Not the hybrid principle.
And
So this is the...
I want a little bit add, Professor Bari. Ilizarov, this is not only methods. Ilizarov, this is not only apparatus. Ilizarov, this is not only philosophy. Ilizarov, the art. And this is methods not for all of. This is like music. If you cannot hearing, impossible teach you. And I think for us will enough, not for all of young orthopedic surgeon. From 10, maximum 2. And for us will enough. We will give them all of our experience, of all of our knowledge. And I think we have a very good future. Because just now, from 3 countries, we can collaborate. And I want to repeat again. Sunrise on the east, on the west, sunset. And I am happy because just now so many doctors in the world use our Ilizarov Russian methods. Thank you for you. Thank you very much.
I really agree with Novikov sir and Bari sir that Ilizarov works like magic. It's a real art. You have to feel it from here. You must, if you follow the principles and the principles, you get where the other regular orthopedics end. Ilizarov starts here. The best part is you can do full weight bearing next day of surgery. This is minimally invasive, which all other surgeons, orthopedic surgeons, are using in AO methods. Ilizarov has been using it from very earlier. So if you follow the biology, it's a very good result. In osteomyelitis and fracture and trauma, I usually do in maximum trauma, primary trauma cases, I do Ilizarov only and get very good results. Osteomyelitis children has a great healing capacity, and Ilizarov does magic over there. Sir, as I recommended, I really request all over the world that we should add a chapter of Ilizarov in the basic orthopedic graduates.
Yes.
And it's a
Thank
modular
you.
implant. Yes, sir. Thank you, sir. It's a modular implant. We can adjust it anytime we need. We can adjust deformities anything we time. We can do lengthening. We can do transport as needed. It's not finished in the surgery. We can do anytime we need it.
And today, our topic, osteomyelitis in children. Impossible help with
Thank you very
same
much, sir.
we cannot help this patient with osteomyelitis. Thank you, Bari. And today you show great examples.
Next topic, what will be the next Friday, Tanvir?
I want to ask you, we can, Bari, we can show some patient with second lengthening. For example, tibia, because some patients we touch 2, 3, and more times. Or
Sir, we will discuss it later on with you, sir. Yes, sir.
Yeah, possible. We can contact by email on Monday, and we will select from a few topics which will better.
Tanvir, if you have any suggestions, you can put this suggestion next Friday, or later on we can go for re-lengthening. Before that,
Sir,
if you
please
have
continue,
suggestion,
Or, for example, cosmetic lengthening, if you want.
cosmetic lengthening, ki bolo? Or any other thing?
Or lengthening in cases of polio.
Lengthening in case of polio case.
Sir, I have
Idea?
Sir, I don't have any suggestion, but I have a request to you, sir. I want to continue the osteomyelitis for a second. No, sir.
Second, okay.
Osteomyelitis in adults.
Adult, okay. Let us have a.
We want to do a second episode with osteomyelitis. Is it possible? Or
okay?
Yes, sir. Osteomyelitis
possible,
in adults.
why not?
Dr. Bari, very sorry. During my life,
we have just covered the osteomyelitis in children, and we want to cover the second episode of osteomyelitis. That is osteomyelitis in adults.
In adults, yeah, wonderful.
Okay. It will combine infected non-union and at the same time osteomyelitis.
Right.
We will
infected non-union and infected non-union and osteomyelitis. You can combine these two.
Okay.
In adult. Okay.
Adult,
the topic will be delivered by Novikov or I myself.
Better you, because during my life, I haven't patient with osteomyelitis. Haven't. No, okay. But we have in our center we have a special department. We have so many patients, but in our department, never patient with osteomyelitis. All patients has some infections there, but never go to complication.
That will be great, sir. That will be great.
Okay, then I will talk on osteomyelitis adults and infected non-union. Okay?
Perfect, sir.
Agree?
Yes.
Next week, okay, no problem. Thank you very much for joining us. Uda, Tanvir, and Novikov.
Thanks, sir. Thanks, and
today
from India. Yeah.
Today 50 years.
We have lots of patients of osteomyelitis, sir.
Congratulations. Very great day.
Okay, sir.
Excellent.
Next session is yours. Next.
Okay. Thank you.
Okay, sir.
Thank you.
The next Friday is yours, sir. Okay. And Professor Novikov, sir, will be in the... Okay, sir. Thank you.
And Huda will join also?
If I can join, sir.
Thank you. Thank you very much, sir. Thank you very much, all of you.
Thank you, sir.
Okay,
I would like to thank... Yes, sir.
Bye-bye.
Bye, sir. Thanks a lot, sir. Thanks, everybody.
Okay,
thanks for being here.
See you. Okay, bye.
I would like to thank both all of three, as because of you joined with us and share your valuable knowledge with us. And I hope we'll see you in the next Friday in our Orthopedic Solution Academy program. Definitely, sir. We hope so.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.